The Aortic Center at Mount Sinai Medical Center is a world-class healthcare facility that is helping take care of your health with cutting-edge technology, and we're here to meet Dr. Ayad to learn more about it. So follow me and let's meet the doctor. I'm now joined by Dr. Ayad at Mount Sinai Medical Center, and we're here today to talk about the Aortic Center at Mount Sinai Medical Center. So Dr. Ayad, thanks for joining us.
Thank you so much for having me.
Of course. What do you do at the Aortic Center?
So my role, I am a vascular endovascular surgeon, and that's by definition dealing with all the blood vessels in the body outside of the heart or the brain.
Okay, so who comes to see you?
Any patient that have aortic aneurysms, which is dilation of the arteries, or dissection, that's a tear in the artery, or blockages in any of these arteries.
How would I know if I'm experiencing something like that?
That is a million-dollar question. And depending on the disease itself, the aneurysms, you actually more often than not, you don't feel any symptoms. Blockage is a bit more forward. If you have a blockage to artery in the leg, then your legs will ache. If you have a blockage to the arteries to your intestines, whenever you eat, you'll have a stomach ache every time you eat, and so on.
Is there something we can do to prevent this?
Absolutely. I think the main things is overall what everybody gets advice from a cardiovascular health, that to try to not smoke, to try to watch your diet from a concept of moderation or Mediterranean diet, a lot of white meats, olive oil, low salt, control, make sure your diabetes or your cholesterol or your blood pressure is well controlled. And lastly, having some exercise definitely help.
Mount Sinai Medical Center has an affiliation with Columbia University, correct?
Absolutely. Truthfully, this affiliation allows the population down here in South Florida to have access to world-class care by having all of these specialties that together between Mount Sinai and Columbia are able to vet the process of patient care, quality metrics, and proper patient outcomes based on evidence-based practices.
This aneurysm could have very easily dilated and I probably wouldn't be here, but they caught it early. They practically hold you by the hand and tell you step by step what to expect. So there's no surprises. The whole thing went exactly as they predicted it, from start to finish. Feeling great, healthy, recovering, and it's like a second shot. Incredible staff, highest credentials. You're in good hands. These are the best of the best of the best.
Overall, heart health, cardiovascular health, what's new on the horizon, or what's exciting what you guys are working on right now?
Truthfully, the most exciting thing for us is the integration of AI. I mean, artificial intelligence has been grabbing a lot of attention. We just recently integrated an AI platform software in our operating room suite that allows us to perform complex aortic surgery with less contrast, so it's more protection for the patient kidney, less radiation, so it's less risk of side effects from the radiation on the patients, and to be able to do it precisely and yet minimally invasive way to shorten the hospital stay for all patients. I think the Mount Sinai Aortic Center provides the patients with a collective of different specialties that give them the highest chance of having tailored care and best outcomes in South Florida.
Wow, we love that. Well, if we'd like to learn a little bit more about the Aortic Center, how can we?
Please go to our website on the Mount Sinai Medical Center website or call the Aortic Center. We have a dedicated line and we'd be happy to sit any patient who needs to be seen as soon as possible.
Great. Well, doctor, thank you so much for your time.
And thank you for having me.
Of course.